Hello people, in this video let us look at torsion testis. This is the torsion of the spermatic cord, the twisting of the spermatic cord, isn't it? Look at this image here to understand. So here you can see that this is the spermatic cord with some pimpiniform plexus around it, etc. right? And here you can see how the spermatic cord is twisted, and along with it all the vessels also. So here this testicle will have decreased blood flow and this testicle can die. So basically in young boys this you should be very careful when they come with abdominal pain. You should examine the testis. Okay, so let's look at this. Why does this happen? Because of inversion of testis, where testis lies horizontally or it lies upside down. So you can see here how the testis is lying in a different way. Abnormally it is lying, right? So inversion of testis is the most common cause, where testis itself is in a wrong position, horizontal or upside down. Okay. High investment of tunica vaginalis, that is the bell clapper deformity. Look at this one for that, bell clapper deformity. So this one they are showing you is bell clapper deformity. What exactly is bell clapper deformity? The insertion of what? Tunica vaginalis they are saying, right? Now where is the tunica vaginalis? This pink is tunica vaginalis, right? This pink one. So it's very high up. That's what we feel like. High investment of tunica vaginalis. Yes, bell clapper deformity. Did you understand, people? It's quite easy to understand. See, this pink thing, in this one is just around the testis, but this pink thing is very high. High investment of tunica vaginalis, bell clapper anomaly. So this will lead to this torsion of testis. Okay. Then, in cases where the body of the testis is separated from the epididymis. So the body of the testis is separated from the epididymis. So where is this epididymis? This thing here, this curve here is the epididymis, and this is the body of the testis. So if these two are separate, then again this can happen. Torsion of testis. Okay, that's what they are saying here. Sudden contraction of spirally attached cremasteric muscle. Now where is this cremasteric muscle? It is around the testis here only, right? Inside the scrotum. There's a contraction of spirally attached cremasteric muscle leads to rotation of testis. The testis gets rotated around its vertical axis when you are passing stools, etc., and lifting heavy weight, coitus, etc. So this is where you can ask the patient history. Did you strain at stools, or did you lift weight, or did you have coitus, etc.? So then you can one cause you will get. Okay, so basically spirally attached cremasteric muscle. Where is this cremasteric muscle? See here, cremasteric muscle they have shown here, all around. So here spermatic cord, around that also it's there, and this muscle will get what? Spirally attached. Sudden contraction of this muscle. So it will lead to the rotation of the testis around the vertical axis. Okay. Especially when you strain during stools, lifting weight, coitus. A long redundant spermatic cord allows twisting of. See, basically it's a long spermatic cord. So it will get twisted, you can say, on its own axis. Okay. So you understood all the causes. Can you tell the causes of torsion testis? Come on. A long spermatic cord, very good, a long spermatic cord, and then this cremasteric muscle is spirally attached and it will contract suddenly, okay, during coitus, etc. Okay, and then epididymis separate from the testis, very good. Then high investment of tunica vaginalis, very good. Then one more thing, I think the first point we forgot. What's the first point we saw? Inversion of testis. Yeah, it is sitting horizontally or upside down, very good. I think everything else we have told. Very good, people. Very good. Now let's move on. Types of testicular torsion: extravaginal, intravaginal. Here they are talking about the tunica vaginalis. Okay, that is the thing here. That whatever they are showing in light blue around this testis. See here. Intravaginal torsion means within this blue color it is twisted. Okay, extravaginal means including that with tunica vaginalis it's twisted. So extravaginal is seen in newborns, and intravaginal will come later in other age mostly, but it can occur at any age also. So extravaginal, what is happening? Spermatic cord and tunica vaginalis are rotated as a unit, one unit. Spermatic cord and tunica vaginalis together they are twisting. In intravaginal it is within the tunica vaginalis. Very good. Now what are they trying to show here? Let's see. So here, can you say what this is? This is intravaginal, very good. This is extravaginal, very good. And what is this? This is torsion due to long mesocorium, they are saying. Okay, anyways, we are learning only extra and intra, right? Okay, clinical features, there will be sudden, this puberty age boys or even till 25 years, sudden agonizing pain in the groin, lower abdomen, they may have vomiting. Remember, they can have just pain in the lower abdomen, groin. Groin is where your abdomen ends and your thigh begins, that kind of area, right? Scrotum is empty and edematous on the side of lesion. Where will the testis go if it is empty? Scrotum is empty and edematous. Tender lump at the external abdominal ring. This is external abdominal ring is what? External ring of the inguinal canal, right? The testis is positioned high. Deming sign. Then you have then Prehn's sign. Then Angeli sign. Okay, let us look at this Prehn sign. Elevation of scrotum increases pain and torsion of completely descended testis. So if the scrotum elevates, elevation of scrotum increases the pain. If you elevate the scrotum, if the pain is more. Okay, if this is completely distended testis, this is called as Prehn sign. Poor boy, he is undergoing so much pain. Okay, then Angeli sign. The opposite testis lies horizontally because of the presence of mesochorium. This we saw already, some mesochorium, right? So one thing we understood here, they have tried to represent it in some kind of a flow chart here. See, they're saying here, if you lift the scrotum, elevate the scrotum, if there is more pain, it's testicular torsion. If there is less pain, it is epididymo-orchitis. Okay, this is very important to understand that they have written here as Prehn's sign. Prehn's sign. Prehn's sign. However you want to say that, guys, elevation of scrotum increases pain and torsion of completely descended testis. It decreases, the pain decreases in epididymo-orchitis. Okay. So please remember this is very important, Prehn's sign. Okay. So, can you tell the clinical features of torsion testis? He'll come with pain in groin, lower abdomen, vomiting, and it will be a 16 to 25-year-old boy, right? 16 or 11? Yeah, 10 to 25-year-old boy. Very good. Then, if we check the scrotum, it could be empty edematous, okay? Then, if we, Deming sign was there, no? Deming's sign. Tender lump at abdominal ring, external ring, the testis is positioned high. Prehn's sign. The testis is high. Why is the testis high? Because of all the torsion, it's got pulled up, right? That is why. Prehn's sign. If you elevate the scrotum, it increases the pain in testicular torsion. Okay, very good. Angel's sign. Angel's sign. Opposite testis lies horizontally because of the presence of mesochorium. What are they trying to say here? That means the normal one is having mesochorium. Guys, it's better we focus on this Prehn's sign only, okay? Prehn's sign is very, very important. What they are saying is when you elevate it, there will be more pain in torsion testis. And when you elevate it, there will be less pain in epididymo-orchitis because the elevation takes the weight of the testis off the epididymal suspension. Okay. So, you are, when you elevate it, you are basically taking off the pull of the gravity, etc. So, in epididymo-orchitis, the pain will reduce when you elevate the scrotum. Okay. So, this is the Prehn's sign, very important. Now let's go to the management. How will you manage? You have to take the consent for orchidectomy before exploration because you may have to remove the testis, right? So you must counsel and consent before exploration. Then only they are exploring and seeing what happens. A scrotal Doppler to confirm the diagnosis. You will wait for it to untwist manually, is it, in the first hour. If not successful, urgent exploration you have to do. You have to undo the torsion and you have to check if there is a viable testis. Okay. Any gangrenous testis you should remove. Opposite side testis should be fixed at an early date to prevent torsion of it also. Okay. Opposite side testis also should be fixed. So this is the treatment. So you will first take off consent that we have to do orchidectomy. You have to please understand. Then only you will start all the procedure. Doppler you will do. Then you will confirm the diagnosis. Then you will wait for it to untwist, then you have to do exploration. So before exploration means somewhere here we have to put this. Here. Patient should be counseled. This one should come here before the exploration. Then you will explore and then if it is viable, you will try to preserve it, testis and all. But if it is gangrenous, you'll have to remove it. Okay. And the opposite side testis at an early state, you will have to fix it. That's it, guys. So if a boy comes with lower abdominal pain, you should always do testis examination, scrotum examination. Okay. Bye-bye.